I want to start with what I think is the crux of this issue, especially in a city like Detroit. And it is this stigma that continues to kind of follow the issue of mental illness, especially in the Black community. Of course, there is a stigma in our society in general around the idea of mental illness. And I think there are lots of things we don't understand about it or really understand how to treat. But this is a particular issue with African Americans. And so with May being Mental Health Awareness Month, I want to give you a chance to talk about how hard that stigma makes it to make progress.
Absolutely. When you talk about trauma in particular, trauma, amongst our youth and children, when you hear a gunshot and you talk to kids and that seems to be the norm, it's not the norm. And, for a long time, and even today, mental health sometimes is considered a weakness within the African-American community. And I find that so strange, because everyone has an uncle or an aunt who, from your time growing up, what you were told by the folks were that, oh, that's just, James is going through it or whatever it was. And it creates such a challenge for us within the profession because we want to be accessible. We want to reach young people. We want to reach our seniors and, our adults as well. But when you have that stigma there, you first have to overcome that. And some of the ways in which you do that is simply by communicating and recognizing too that mental health is no different from physical health. There's a reason why, Stephen, within our communities, we have urgent, care centers there, because we know that one day you and myself will be cooking and we'll cut ourselves and we'll need some place to go to receive services. Mm-hmm. Within the behavioral health world, you come upon those challenges in life, something happens that just completely change things for you, and you need someone to talk to, and there's nothing wrong with that.
Yeah. So let's talk about how you approach then Mental Health Awareness Month here in Wayne County, where the city of Detroit is the largest jurisdiction, and it's the largest majority Black city in the country. There's got to be an effect of those factors on the way that we even start to talk about mental health.
Absolutely. At Detroit Wayne, we serve well over 75,000 folks. Last year, even in the midst of COVID, we serve over 200,000 folks. Within Detroit, 40,000 of our core members are in the city. Mm-hmm. And so whether we're talking about our 1-800 number, 1-800-241-4949, that's a number that folks can use to access our services. Regarding our young folks, we also realized that, Stephen, unlike you and myself back in the day, we'll pick up the phone and have, phone conversations. Now young people text, so we came up with reachusdetroit.org is, you can use that for text messaging, receiving well up to 12, counseling sessions. The same is true with our 313-488-HOPE, another, source that folks can call to receive services. What we find, or what we are finding though, is that you first have to start with access. Folks have to know who you are and what it is that you provide in terms of resources. Mm-hmm. The next step is then, how do you make those resources so that folks can come and receive those services, or you go to them? I mean, sometimes the mountain has to come to Moses, and within the mental health space, transportation, something to eat, a roof above your heads, those are all social determinant factors that we have to be concerned with. That's in the physical health world. Your doc and my doc are not concerned as to how we're making that appointment, but within the behavioral world, that matters. So we have made those things as part of our way of making sure that people have access to care and improving the quality of health for them as well.
The access barriers also play a role here, and of course play an outsized role in the African American community. I feel like that has gotten a bit better. There is more access now thanks to the healthcare reform passed now almost a decade ago and enacted almost a decade ago. But we still have hurdles there and barriers to people being able to access mental health, which is still treated differently from an
Yes.
access standpoint than other health issues.
And this is why when I have an opportunity to speak with folks such as Herman Moore, who, he and I were on a program not too long ago, and we talked about, and here is a prominent athlete, who was able to share his challenges growing up. And I think when young folks, older folks recognize that you are not alone in this at all, when you have athletes, who have gone through this, Naomi Okasaka, for example, here is, a tennis, phenom who challenges with mental health was brought on the stage, to have those types of discussions. I think when people see those things happening, there is an identification process there that says that you are not alone in this. And I think the more opportunities that people get to see and hear this being discussed, it lessens the stigma. Stigma will always be out there. Let me make that very clear. Stephen, I don't think if we were to do an incredible job today or tomorrow, it would necessarily solve it. But I think some of the little things that we can do is to listen to. We have to listen and understand what folks are going through. COVID exacerbated a lot of health challenges, that were always there, but they were just brought to light in all of its prominence because of that.
Yeah. So let's talk more about the pandemic and the effect it has on the work to address mental health in particular. I've kind of identify a couple of different challenges there. One is, of course, the loss and the grief that so many people, especially in our community, experienced because of COVID. There's the isolation that COVID forced on all of us and the disconnection from our families and our friends, and then there is the economic insecurity that it absolutely inflicted on people, which is sometimes a trigger for mental health. It seems like you've got a lot on your plate there.
Absolutely. And look, you have health disparity, and so starting with that, and then you put the economic challenges and barriers that are also part of that, so these are things that have always existed, and there are times that we try to solve them as best as we can. But can you imagine those things haven't always been there? Now you put COVID as part of that as well. And then there is also the sense of, we are a community, folks, African Americans, we love to be around each other. And I tell you, those were some difficult days and months to go through when, you couldn't go and see grandma, or you just couldn't get into those communal settings that we've been so used to. But at the same time, though, organizations such as ours, we were going out in the community with mobile health services because we realized that folks weren't coming to buildings. So we needed to go to those spaces that they were in, whether they were their community centers, parking lots that we find folks in, barbershops that we find folks in. We needed to make sure that we kept connected with folks. And then when you talk about technology, folks often say, well, there's always telehealth. Well, in some of our communities, access to the web isn't something that is as ready as our telephones, so we had those challenges. And so we invested in those communities by actually buying laptops and telephones. And now that you bought the laptops and telephones, you need to have the internet sources that folks can use in order to access those services. So we invested in those things, Stephen, because there was a recognition that we wanted to keep folks in contact with services, and we wanted those services to continue.
Yeah. So I also want to ask you about the way we should approach not the people who are suffering from mental health challenges, but their families and the people closest to them, and what they can do to make this whole process easier. I think one of the things that we don't talk enough about is the struggle of living with someone who has a mental health issue or challenge, and making sure that that person is ready to get the help that they need, and knows how to do it. What about the I guess caregiving aspect of this?
I tell you what, a wonderful question. You know, people are not independent of others. They are connected to others. And this is why when we provide services, you know, to whether it's an adult or a child, we want to connect with the families. You know, when we talk about crisis services, for example, we don't have a crisis center, a true crisis center here in Wayne County. We do in Oakland County in terms of common ground. At Detroit Wayne, we are building one. By the end of this month, we will have one built here. What that does, though, now you're talking about someone in terms of a family member who realizes that, gosh, I have, you know, a loved one here who's struggling, but I have nowhere to turn. I either call the police, okay, or I take them down to the emergency room. The emergency room is not a place for folks who are experiencing mental health challenges to be treated. I mean, it's just not, and docs will tell you that any day. The jail setting is also not a place for folks to receive services when they're going through those challenges. So we want to be able to connect with families to let them know that we are a resource. It starts with educating them first. Mm-hmm. But in educating, you also have to have the resources that are connected to that. And Stephen, this is why I tell people all the time, these are services that are free. You know, they are free, you know, free because your tax dollars are working for you. And I think when people know that, there is that sense of you're not alone in this, in providing that care for your loved one. We are here to listen. We are also here to help as well.